is proudly brought to you by Fremol.
For fast relief from headache, toothache, pain and fever, Fremol is the answer. Available in all drug shops and pharmacies countrywide. If symptoms persist, seek medical advice. Fremol, tested, trusted and dependable.
Drug abuse is a common health problem that affects our families and communities. In fact, some celebrities have died because of drug abuse. You may have different perspectives about drug abuse, but let's see what specialists have to say about drug abuse. Today we are at City Medicals and the doctors are going to explain to us what exactly is drug abuse. My name is Mary and welcome to Health Facts. And don't forget that this show is brought to you by Fremol. If you have any upsets, fever or any headache, please take Fremol. Stay tuned. Hello doctor, welcome to the show.
Thank you.
Okay, so doctor, tell us who you are and what you do at City Medicals.
Yes, I'm Dr. Ben Ochola, medical doctor at City Medicals. At City Medicals we did in travel medicine, immunizations and vaccination, screening of patients for drugs of abuse, and also general medical care.
Most of us have different perspectives about drug abuse. What exactly is drug abuse to you as a doctor?
Drug abuse is in different forms and in various drugs that are being abused in our country here. We have recreational drugs that are the major abused drugs, and we have medically prescribed drugs that are being abused by the population at large. However, because we have the recreational drugs as the major abused, let me start with those. We have various forms of the drugs that are being abused in a recreational basis. And in our country here, alcohol is the biggest and major abused drug. It is abused in different forms. We find that most of the youth are taking alcohol in form of circuits to boost them in their day-to-day activities. However, there are other drugs, like I said, that are being abused, and I'll mention a few. We have cat, that is commonly known as mayunji. We have marijuana, we have cocaine, we have heroin. We have medically prescribed drugs that are being abused by patients. I'll give examples of drugs usually made to alleviate pain. A very good example is pethidine. Pethidine is one of the drugs we give in order to manage pain, very excruciating pain, but because it gives the relief in such a short time, people that have chronic pain tend to misuse it, use it to a way that is not to the prescribed dosage, and in such a case get addicted to it. Other medical abused drugs, you may have benzodiazepines. People take them, for example, diazepam, people take them to get sleep. They also drugs that they misuse in form of gaining weight. They are usually made for other effects, but because the side effect of the drug may be weight gain, so you may find that some people take them to gain weight. And vice versa is true. There are those that may lead to loss of weight, and people may take them to lose weight.
So doctor, tell us, how common is drug abuse in Uganda and how do people access them? How do people access these drugs?
About 60% of urban youth are abusing drugs. And drugs of abuse, majorly, they're easily accessible to our youth, unfortunately. You find that alcohol is readily available in the smallest shack around town. Cat is sold on the streets. And some of these medical abused drugs are readily available in the local drug shops, in that they may not need a practitioner's prescription to access them. So you find that it is easy to get across these drugs and abuse them.
Health Facts is brought to you by Fremol. If you have headache or chest pain, could be back pain, please take Fremol. You'll feel free. Joining me is Dr. Mathew, who is going to tell us how to treat and manage drug addiction and drug abuse. Stay tuned.
Ladies and gentlemen, welcome to our show.
Ladies and gentlemen, welcome to our program. I'm your host tonight, Lady Aisha.
For fast relief from headache, toothache, pain and fever, Fremol is the answer. Available in all drug shops and pharmacies countrywide. If symptoms persist, seek medical advice. Fremol, tested, trusted and dependable.
Hello Doctor, welcome to the show.
Thank you very much. I'm happy to be here.
Okay, so Doctor, tell us who you are and what you're doing at City Medicals.
I'm Dr. Mathew Kagwisagye. I'm a medical officer at City Medicals, Bukoto. And at City Medicals, we do day-to-day vaccination and travel medicine, as well as outpatient services to our patients.
When people take too much drugs, they become addicted. To you as a doctor, what is drug addiction?
So in the medical field, drug addiction is simply defined as a complex disorder characterized by compulsive drug use. So expounding more on that, drug addiction would mean that someone sees it as part of himself to continue using this drug. He's compelled to continue using it despite its medical uses to him. He just continues using the drug on and on. And that's the compulsiveness that I'm trying to explain.
Doctor, what are the problems associated with drug abuse?
So, drug abuse and addiction would eventually cause a diverse spectrum of problems to this patient, ranging from the physical disorders, the behavioral disorders, and the psychological disorders. So the people addicted to these drugs physically would present with an unkempt look because they are no longer taking care of themselves. Sometimes they appear to be unhygienic. They have dirty clothes, and another thing that usually these addicted people have is that generally they can even get some diseases. Consequences of drug addiction can include someone having physical deterioration of his body, generally in terms of weight loss, sometimes weight gain, poor personal hygiene, so the person appears unkempt. Some of the physical symptoms of these patients can be as a result of withdrawal from these drugs, which can be tremors, someone is seen tremulous, someone has bloodshot eyes, like the people who take marijuana. Psychologically, this person can present, or his relatives can realize that this person has mood disorders. Person is always irritable, having mood swings. The person can get aggressive. Someone can get thought disorders, started hearing things, talking to him. So that's when the mental illness creeps in. Another psychological consequence of this can be withdrawal. The person can get withdrawn from his frequent society, his friends, and he's no longer interested in doing what he usually did. Like, let's say someone on a Friday night usually went out with his friends. All of a sudden, he's no longer doing that. He's more withdrawn. Those are more of the psychological consequences. Behavioral, the behavior of the person in terms of his workplace. The person is no longer working at standard in his workplace. At school, the grades are going down. Deterioration of relationships, is no longer consorting well with his spouse. Also, the aggressiveness can come in here, and many more examples. It's a very big spectrum of.
Doctor, how do you treat people and manage people who have abused drugs?
there are very many ways in which these drug addictions and abuse can be treated. And from the definition I gave, that it's a complex disorder, it also requires complex input of medical, psychiatric, support groups to actually manage this condition. Initially, one encounter with a person seemed suspected to be addicted to a particular drug. So once someone has been suspected to be a drug abuser or an addict, we first take a comprehensive history. In simple terms, it means digging up the information that led to the current picture you're seeing as a doctor. So mainly we look at the family background, the kinds of peers that this person has been with this whole time. We look at the different behavioral changes that this person has been having, as well as the mental and the physical, so that we can come up with a diagnosis. In addition to that, we have to realize that addiction has two prongs mainly. We are having the psychological dependence and the physical dependence. Let me explain more about those. So, psychologically, for example, you take alcohol. It brings a sense of euphoria, a sense of happiness that that makes your brain secrete a drug called dopamine. I won't go much into the pharmacology or the medical nitty-gritty of that drug in the brain. But in simple terms, what it does, it excites the brain. But the brain keeps this sensation as a sensation of happiness, and the brain craves for that. So psychologically, the person will always want to go back and take a beer or to bring back that feeling. So that is the psychological dependence. And the person will eventually be compelled to go back to the bar and get another drink. So aside from that, there is the physical dependence. Also, case in point, alcohol. Alcohol is a drug, and it has its effects on the body. So when that drug is removed, if you stop drinking suddenly, there are some symptoms that come about. Maybe you start sweating a lot, you can no longer sleep, you're restless, you're agitated all the time. Those are the physical symptoms, or in other words, withdrawal symptoms. So these also will compel you to go back and drink so that you don't experience them again. So our management is mainly geared towards tackling those to a point that someone can actually go away from the drug without those symptoms. We have encountered our patient. We have to do a comprehensive assessment of this patient, not only towards the drug of addiction. So you might find this is an alcoholic who has been addicted, and over time he went into risky behavior, and he got HIV. So if you only look at one aspect, you wouldn't manage him very well. So you have to comprehensively assess the patient. You might have got into a bar fight and got an injury of some sort. So you do a full physical assessment, full physical exam, you assess all systems. Then after that, we get into the management of this patient. The management would involve medical management, which requires drugs, and also psychological management, which would require psychiatrists, counselors, support groups, even their family members and close relatives. Another prong to management is actually investigations. We are very happy that at City Medicals we can actually screen and do periodic monitoring of these drugs of abuse. We have a very well-equipped lab to do all this, and my colleague will come in later to expound more about what the laboratory can do for us. So in our management course, medically, we look at the physical effects of these drugs on the body. And we can actually encounter a patient when he has effects of the drug or withdrawal effects when he has not taken the drug for a long time. I'll give examples of some of the common drugs. For example, marijuana. Marijuana is very common in Kampala, and one of its main signs that we can look for, someone has red, bloodshot eyes, there is dilatation of the eyes, the person is usually agitated, aggressive, sweating excessively, and this can be the same symptoms that the person comes with when he has withdrawn from the drug. So management of that case would require looking at the particular symptoms that are rising, and you manage as you taper down the dose of the drug. So another class of drugs, okay, I must say that usually these drugs of addiction either excite the brain, these are called stimulants, or depress the brain, which are called depressants. So the management of depressants and stimulants are more or less the same. So I'll give a case in point of a stimulant, for example, cocaine, and some of the effects that it would bring, and its management, and then that would cater for the management of other drugs in the same class. However, there are slight variations. So cocaine, usually patients also present with anxiety, irritability, excessive sweating. They can be euphoric, they are very happy, and also they can have physical consequences of their drug. Cocaine can be amphetamines, which are contained in the Mairungi or the Chati. We can have the morphine, heroin, pethidine. All these can excite the brain and cause the addiction and bring up the same symptoms. Management is more or less the same. However, to disrupt the normal effects of the drug, the good thing is that we have antidotes. There are drugs that can actually neutralize the effects of these drugs. There are drugs that depress the brain. These are usually taken in people who have anxiety, who have irritability, either naturally or due to a different psychiatric disorder. But these can also be, you can also develop addiction to these. These include diazepam, which in other terms can be the Valium. There are other drugs like clonazepam in that class. So usually patients present with drowsiness, constricted eye pupils of the eyes. Someone can have sleep disorders, to mention but a few. The good thing is that these as well can be managed very well, and It's a very manageable class of drugs, but it usually takes time because I say it's a complex disorder. To emphasize the psychological management, as the team leader, we have psychiatrists who can work in conjunction with the counselors, with the support groups. I think you've heard of Alcoholic Anonymous. These are support groups. You find people who are actually suffering from the same condition, and they help support each other to actually get out of this addiction. Close family can actually be of much help. There is a concept called motivational behavioral counseling, whereby with interaction with the patient or the client, you can set goals, realistic goals, and over time you can actually overcome this addiction. So that in simple terms is the way we manage addiction, and this can be managed in very many centers. We have a referral hospital in Butabika, the psychiatric patients. There's an alcohol and drug abuse center there. Mulago has these services as well. So this is managed, and there are very many patients who have gone through this program.
Doctor, tell us, why do people get addicted to drugs and others don't, and yet they use same drugs or they take same drugs?
People would get addicted at different levels while taking the same drug, mainly because of genetics. Yeah, we are different, we are made up differently. So the way a drug affects you is not the way it affects me. So eventually I might get addicted and you're not. Another key factor is actually psychosocial problems. So you might find an individual has his own social stressors that have compelled him to using the alcohol. However, this other person does not have. So the person with stressors is more likely to get addicted.
If I'm pregnant and I'm abusing drugs, can it affect my baby?
So pregnancy and drug addiction, pharmacologically, these drugs have varying potentials of crossing the placenta to access the baby's body and cause effects. So there are some, it depends on the time at which these drugs of addiction are taken. If it started early in the pregnancy, surely drugs that have potential of crossing, for example, alcohol and the depressants like diazepam, can actually cause effects to the baby and interrupt the development of this baby. Other effects can be later on, actually depressing the baby, and the baby can actually die in the womb. But there are other drugs that have been seen not to have potential of crossing, and the harm comes to the mother and also to the baby because of the mother's behaviors. Maybe the mother is not eating well, the mother is fighting and getting injuries that would affect the baby. Yeah, so that's how indirectly it can affect.
Joining me is Dr. Muhammad, who is going to tell us how many tests or what kind of tests you can run for a person who has been abusing drugs.
Basically, here we shall look at the test. We're looking at the tests that we do in the lab. There are quite a number of tests that may be done to find out which drug someone may be addicted to. You find out that drug addiction, basically, it is toxic to the body. So most of the tests that are done are basically toxicological tests to define out the degree or level of toxicity or which drug someone may be addicted to. So in some of these tests that we do, we have what we call rapid chromatographic flow cytometry. So there are quite a number of samples that could be used, because after the drugs are toxic. So after being toxic in the body, at times the body reacts towards removing any toxic substance. So we discover that some of this may come out when we release through sweat. Some of them may come out as urine, may be excreted through urine, and then at times some may be circulating within the blood. But basically here, we're using this chromatographic acid, amino acid. We usually look at urine as being the primary sample, simply because it is easy to collect, and it can be got at any time. Just when the patient comes in, you can always talk to them, and it is one of the most convenient samples. So what happens when you get this urine sample and you have these assay kits? Usually just need to get like 4 to 5 drops and put on each kit. And then after this will flow through the kit, after which we shall detect the results. The principle of the kit is based on competitive binding. You will find that if someone has drugs in their urine or in their body, they will be beyond the cut-off points within the body, because each drug has levels within which it shouldn't go beyond. So if they go and exceed beyond the cut-off levels in the body, this will come and then react. It will compete favorably with the drug conjugate in the kit, and then it will bind to the antibodies of the drug, and then after binding it will fill the antibodies. Therefore, the antibodies will not bind to the conjugate, the drug conjugate. Therefore, there will be no line that will be shown, because usually this shows color bands. So there will be no color band formed, and therefore that is for that specific drug that someone is addicted to. Any drug in saturation, it will compete with bind to the antibodies, out-competing the drug conjugate, and then in the end we shall not see a reaction on the strip, and then specifically that drug will be in saturation in someone's what?
Doctor, thank you for your amazing advice to people.
Okay, you're welcome, please.
Alright, have a good night. If you want to take full control of your life, stop taking drugs. This show was brought to you by Fremo. If you have headache, chest pain, back pain, take Fremo and you'll be free. That's all I had for you tonight. Until next time, have a good night. Don't forget to visit us on our Facebook page, which is Health Facts UBCTV. I've been your host, Mary. Until next time, have a good night.
Brought to you by. For fast relief from headache, toothache, pain and fever, Fremol is the answer. Available in all drug shops and pharmacies countrywide. If symptoms persist, seek medical advice. Fremol, tested, trusted and dependable.